What do you need to know for evaluation and management for a medical coding certification exam? Quite a few little basics, but let's get into them. Time is key for the first set of E&M codes, so be sure you understand the meaning of time. MDM is the next thing you need to know for the first set of E&M codes. We call it medical decision making, but we give it an abbreviation and we call it MDM. So you need to learn your guideline about MDM. Be sure and read this page. MDM and time are used for your first set of E&M codes from 99202 to 99215. Those two key components are the main two ingredients for answering any questions with these answers in them. Next thing you need to know about these E&M codes in the very beginning is that they're divided into two sets. The 9920 codes are meant for all new patients, patients that have not been seen in at least 3 years, or are brand new, never been to a practice, always fall with the 0. Anything with a 1 are established patients who have been seen by the doctor within the last 3 years and can be considered an established patient. I'll show you how this works. So in this practice question, we see right away we have an O in our set of answers, and we know that that means that this would be a new patient, which is different from all the other ones. If it was the right answer, we see in our very first sentence that they use the word establish. So we know our patient is established. We know no 0 patients will be there because we need to use only established. So all we need to look the rest of the question for is time or our MDM to figure out if we're in 11, 12, or 13. So I'm just looking for those key terms. I see MDM, which is low. I don't see a number or anything mentioning how long the provider was with the patient. So we'll just take our low complexity to our book and figure out which answer we are. We're going to go right down here to our CPT code descriptor, and we're going to look for our MDM level. 15 is high, 14 is moderate, and 13 is low. So 13 matches our question. So we know the answer to this question is C. That's the first very basics of E&M evaluation of only the first set of codes. I hope this is helpful.